Hi, I'm Dr. David Hughes with the San Antonio Orthopedic Group. Many of my patients have plantar fasciitis, and if anyone has had that, they'll know it can give you incredibly painful heels in the morning. It's aggravated by activity and sometimes makes exercise very difficult. What I'm going to demonstrate today is a type of strapping called low-dye strapping for the foot. This will allow you to stay active and still get some relief from your plantar fasciitis. So what you need is a few simple items you can get at the sporting goods store. First is 1-inch athletic tape. Second would be 4-inch athletic tape. And finally, you'll need some pre-tape spray. I highly suggest you use this because when you exercise or you run or whatnot, you'll tend to sweat, and if you don't, your taping will fall off rapidly. For demonstration purposes, I won't be using that today. And so what you're going to do is basically cut 4 strips of the 1-inch tape, and what you want to do is measure it on the patient's foot. What we're trying to do is start up here by the baby toe, go all the way around the heel, and extend it all the way to what we call the first metatarsal phalangeal joint, or this bump right here. Essentially, you'll cut all 4 strips of the 1-inch tape to that length. Then what we'll do is cut 2 strips of the 4-inch tape, measuring it from the side of the foot about halfway up the arch. So first thing, I would spray my pre-tape and kind of blot the foot on the sides and the bottom, waiting a moment, allowing that to dry so it gets sticky. And secondly, I would take my 1-inch tape strap, starting on the outside of the foot or the baby toe side, right about where the joint is right here, holding the tape firmly, extending all the way around the heel, again finishing over on the first metatarsal phalangeal joint or bump right here. Again, I'm applying tension as I go all the way around. I repeat that with another 1-inch strip of tape, and I generally put it immediately over but slightly overlapping the previous. As you can see, there's about a centimeter of overlap there. At any rate, I hold that tight, wrap it around, and press the tape firmly to the skin. Now we get into the 4-inch tape. Again, it's very important you start on the outside of the foot, or the baby toe side here, and right behind where this bump is, by the baby toe, we anchor the tape down, and you're going to want to pull some tension upward. Remember, you're trying to lift the arch up, so you have to put some tension on the tape, otherwise it won't do any good. After I hold that down, I repeat the same thing, overlapping the previous 4-inch tape slightly, and again pulling on that, so I basically am creating an arch on the inside of the foot. Finally, I use my 1-inch tape and go over the edges just like before. And one more time. Now, the whole point of the low-dye strapping is to take tension off the plantar fascia, which is that ligament on the bottom of your foot that causes you all the arch and heel pain. You get tension off it when you're active, you'll have less pain during and after activity. So this uses the tension in the skin in order to get tension away from the fascia. Basically, you know you're doing a good job if you step down on it and you don't feel like you're walking on the outside of the ankle, yet you feel a support or a pulling of that arch upward. You'll know a big difference. You might have to do it a few times in order to find out the degree of tightness you need to apply the tape and how much tension you need to pull the arch up. But basically, that's how you do a low-dye strapping, and it should help you.